Welcome to Speaking Holistically, the podcast that explores the power of alternative medicine, natural healing, and homeopathic solutions to help you achieve true wellness. Each week, Dr. Jen and Amy G dive into the world of holistic health, discussing researched, time-tested remedies with expert insights from Dr. Jen, as well as real-life stories from patients to empower you to take charge of your health. So if you're ready to embrace a more natural path to wellness, let's start speaking holistically, because true healing begins from within. Hi, everybody. Welcome to Speaking Holistically. I'm your co-host, Amy G. I'm here with my wonderful co-host, Dr. Jen. And today we're talking about common health concerns, and we're talking about a big one, arthritis.
Yep. So a lot of people get diagnosed with arthritis and they come into the office, they're like, I've been diagnosed with arthritis. I'm like, okay, so you have inflammation in your joints. Let's find out why. So just, slapping a name on it doesn't actually fix anything. And some of the things that are being done for them or not done for them are things that we can shift and change in our own daily lives, depending on what's happening. So let's just back up a little bit. And the word arthritis simply means inflammation of the joint. So arthrite means joint, and itis, anytime you have itis, it's inflammation of. So if you have sinusitis, it's inflammation of the sinuses. If you have gastritis, it's inflammation of your stomach. So getting that diagnosis doesn't help anyone, but you want to know more about what type of arthritis, where it's coming. Is it a genetic thing? Is it a lifestyle thing? Like, what can you do to fix it? Because you don't have to live miserably. You just don't have to. So first of all, getting labs tested are going to be important. So some of the labs that I run for arthritis and inflammation are ESR, which is erythrocyte sedimentation rate, C-reactive protein, rheumatoid factor, and then I also do an anti-CCP as well as an anti-nuclear antibody, which is also called an ANA. So this will also help diagnose give you the right diagnosis of what type of arthritis, as well as monitor conditions like rheumatoid arthritis and other autoimmune type situations. So you can do those labs on your own, or you can ask your physician to do those labs for you as well. So the biggest thing is decreasing the inflammation and figuring out why you have that inflammation. So foods can be a huge source of that inflammation. Sugar is a huge pro-inflammatory for people. They don't realize how much they're actually getting. Processed foods are huge as well. Those are very pro-inflammatory for most people. Pasteurized dairy can also be an issue, and nightshades. So I know that there is information coming in and out about nightshades, but I find that if I take a patient off of nightshades, which consist of, you can go look up the entire list, but basically tomatoes, potatoes, eggplant, bell peppers, chilies, stuff like that. And there's a host of other ones as well, but those are the big guys. If I can get a patient off of all of those for at least a month, I tell them 3 months because I know I'm not going to get compliance for 3 months. So I'll tell them 3 months, knowing full well I might get a month worth. And they will go off of them. And then I tell them, once you're off of them for 3 months, then go back and do a low day. Eat as many nightshades as you can and see how you feel when you wake up the next morning. And that will be your test, because they're like, no, I feel fine. I feel fine. I feel fine. And then as they go back to those foods, the inflammation starts to come back, and it's insidious. It's slow. It's not overnight. But if you do a super high load day, the next morning people wake up almost paralyzed because they're in so much pain. It's not even funny. So those are things that people can do kind of to manage their diet. The other thing that I encourage people to do is get genetic labs done, and we'll put a link down below as well for genetic labs that are pretty inexpensive. They run about $350, and you get 30 something pages worth of information. But what's interesting is it'll tell us, or tell you, how your body handles what type of, like, does it need extra vitamin D? Like, maybe you have homozygous genes that are not allowing your body to process vitamin D appropriately, or maybe you're doing an oil D that is not vegan based. And so sometimes if somebody's taking a lot of vitamin D and it's still not coming up, I'll have them do a vegetarian or vegan based micellized vitamin D, and their vitamin D levels start to come up because their body can actually use that. Your genetics really can tell you more of what your body needs, what kind of fats increase inflammation. Desaturated fats cause inflammation, or is it polyunsaturated fats that you need more of or less of or whatever? And so one person will say, oh, my arthritis went away because I did this. your neighbor goes and does it and they end up totally flared up. So that's where those genetics come into play. And for $350, it's well worth its weight in gold to get that information so you can figure out what kind of even oil. So most babies and newborns and even up to toddlers need more DHA than EPA. Now, adults generally need EPA and little to no DHA, but that's not the case for some people genetically. So there are some adults that I will switch. They'll be having taken high EPA levels forever. And once I do their labs for their genetics, I can see that they actually need the DHA. We switch them over and their inflammation literally disappears. So everybody is just a little bit different for that. So some of the things that I recommend are stretching, obviously gentle stretching. We're not going to do these bouncing stretches. It's just yeah. So, I mean, if you're watching TV at night, even if you're sitting in bed, just sit up and do a little bit of stretching and see where muscles feel like they're pulling. And that can also help take some of the pressure off the joints. Exercise. Now, that's going to be an interesting one because there's some people who are like, oh, I run 15 miles a day. That can increase their inflammation. So sometimes too much exercise can be too much for the body, but too little cannot be enough. So finding that sweet spot of maybe starting out with 10 to 15 minutes a day of some sort of cardiovascular that isn't taking stairs or running up a hill or whatever the situation is, just something gentle if you've never really exercised before. And just enough to kind of lubricate and get those joints moving. Water is super important for our joints, for our kidneys, for our brain, for everything. So water is the cheapest, easiest thing that you can do for yourself. Turmeric, a lot of people are taking turmeric. A lot of people are doing nano turmeric because they're finding that the larger molecules of some of this stuff are not getting into the system the way they originally thought. Turmeric can have a GI issue with some people. So I always tell people to start off a little bit slow with turmeric and then work your way up. Turmeric also requires things like black pepper and stuff like that in order for your body to absorb it more proactively. But one of my favorite supplements, honestly, is boswellia. So boswellia is actually Indian frankincense. And so there's a lot of people who are into essential oils now and don't realize that boswellia is frankincense. So there's been a lot of studies on boswellia and its effect on osteoarthritis, which is a type of arthritis. And they found that all 30 people with osteoarthritis knee pain who received boswellia reported decreased knee pain. They also reported an increase in knee flexion and how far that they could walk. So that was back in 2003. There's more studies that have come out as well. And they've all basically supported the use of boswellia. And boswellia also helps reduce the levels of cartilage degrading enzymes. So It's going to help the body not create those enzymes that are degrading it. Rheumatoid arthritis is an autoimmune type situation for people. And there's been mixed results with boswellia. There was an older study that found that boswellia helps to reduce the RA joint swelling. And some research has suggested that boswellia may interfere with the autoimmune process, which would make it an effective therapy for RAs. But anyway, boswellia has been used and frankincense has been used forever for a lot of things, but it's very, very anti-inflammatory. And it does have immune balancing properties. The other thing though too, and I know we're not talking about arthritis, but a lot of people who do have joint inflammation also have gut inflammation or skin inflammation. So boswellia can play a role in reducing the leukotrienes, which cause bronchial muscles to contract. So that will impact your lungs for asthma type situation. But it also has been shown to be effective in treating inflammatory bowel disease like Crohn's and ulcerative colitis.
Wow.
And cancer too. So boswellic acids have been shown to prevent certain enzymes from negatively affecting DNA. So they've also found that boswellia may fight advanced breast cancer cells and may limit the spread of malignant leukemia and brain tumor cells, as well as suppressing the invasion of pancreatic cancer cells, all sorts of stuff. So
wow.
I'll have some patients who have spots on their skin and they're not sure if they're cancerous or not. And like I always tell them, just put some frankincense on it just as a healthy preventative potentially or support or whatever, not necessarily for treatment. But, if it has this much anti-inflammatory properties, you never know how much it can help.
Yeah, I've definitely put frankincense on my skin. That's kind of my go-to if I have a spot on my skin. Even if it's like a blemish and it's like healing, I'm like, I'll put a little on there because it calms it down and it does heal it faster. So I'll just dabble it on there before I go to bed and yeah, it works.
Frank is amazing amazing for skin. So I even put drops of it in my oil that I use on my face because I put straight oil on my face. And so I'll sometimes do that, put 10 or 20 drops of it in there. And I'm like, it's not a bad idea to have that on there every day.
For sure.
So Boswellia products can differ tremendously. There is one from Standard Process. They have a great Boswellia, which I've taken higher doses of it and it hasn't upset my gut at all. But obviously everybody's a little bit different. If somebody's taking pharmaceutical, we want to just be careful with any kind of herb drug interactions. But the general dosing guidelines suggest that taking 300 to 500 milligrams a day by mouth, not just, putting it on topically, 2 to 3 times a day may be helpful, and even more than that for people who have super high inflammatory issues. So that's just Boswellia, but other supplements that people can take that fight inflammation, we talked about the turmeric. Fish oil we did talk about. So do you need the EPA, the DHA, a combination of the EPA, DHA? More and more studies are looking at omega-3 being more important than years ago. They would say, you need a nice balance between the 3, 6s, and 9s. And then they went, maybe just the 3 6s. And now they're saying, maybe just the 3s. So really, you get those genetic labs done and you'll know exactly what type of oil to give your body so that you can have a fighting chance with that inflammation. Ginger can be great for inflammation. Vitamin D, like we talked about, how much vitamin D do you need? What type of vitamin D do you need? Do you need a vegan vegetarian form? Can you just take the regular, oil that's in the capsule? Maybe. So it just sort of depends. Bromelain will also help. Enzymes tend to break that down. There's a great product called Zyflamend, and that can be utilized, and that is full of enzymes to break down those inflammatory pathways, basically. So green tea extract can be helpful. Garlic can be helpful. It's very high in sulfur, so it opens the liver detox pathways a little bit more and helps out with that. Vitamin C can be super helpful, but it's not just vitamin C. It's a vitamin C complex. So it's going to have the entire kit and caboodle of vitamin C as opposed to just ascorbic acid. And we talked about that in a previous podcast. So vitamin C can be really helpful as well. So there's a lot of things that we can do, but if you're getting inflammation in your joints, it's not just in your joints. It is systemic. It's everywhere. You're just feeling it in your joints. So we discussed the pro-inflammatory foods. So anti-inflammatory foods will consist of basically fruits and vegetables and just whole foods, basically anything that you could possibly make or grow on your property besides those nightshades. And some nightshades might not impact the average person, but at the end of the day, if it is you, that's an easy thing to manage. Also, adequate sleep and stress management can help reverse chronic inflammation. So when you have chronic inflammation, it can lead you down the path to cancer, and only 3 to 5% of cancers are genetic. The rest of them are lifestyle. So if you can turn, like we've talked about in every episode, practically turning the Titanic around before it hits the iceberg, that's what you're going to want to do.
Yeah. Well, and inflammation, when you have it, it's excruciating. It's very uncomfortable. Before we figured out that I had Hashimoto's, I remember the pain in my joints just showed up one day and I was like, what's going on? I was trying to blow dry my hair and I couldn't even hold my hair dryer. My shoulder was killing me. And I was like, I had to keep setting the hair dryer down. And I thought, what is happening? And then my hips and my knees, just all my joints hurt. And for me, gluten is inflammatory and I can feel it in my joints. And so I just avoid it. I'll let myself have it once in a while just to feel like a normal person. If there's something I want to have a bite of or a little square of a brownie that I love brownies so much. And so, let myself have that. But in my day-to-day life, I avoid it because I know what it does to my joints and I know how bad it feels. And I go to sleep on my side and I can't lay on my hips. And it's just, it's terrible. So I think this episode is just tremendously helpful because there's a ton of information here that you've given, but getting your genetic testing done, we talk about it ad nauseum on this podcast, but seriously, everybody just get it. And then you'll know what you need for your body specifically. Just like you mentioned, what works for your neighbor is not going to work for you. What even works for your brother or sister may not work for you. Hopefully people will get their genetic testing done and figure out what they need to do. If they do have inflammation, they'll know how to handle it and the right way to approach it specifically for them.
Well, and really that's what it comes down to. If you have a genetic deficiency, basically with processing vitamin C, then you may need to be taking 3,000 milligrams of it a day. And the average person doesn't need to do that. Or you need 6,000 IU of vitamin D based upon your genetic labs, like supporting that liver so the liver can help make those conversions could make such a huge difference. So you don't want to overload on vitamin D just like anything else because it is oil soluble. So shoving more into the body isn't always the healthiest option. But if you get those labs done, and like you said, it's only once you get them done, and then you know exactly how your body handles all of these items so that you can live more comfortably, throughout your life as opposed to, so yeah, you lived a long time, but you were miserable the entire time. Like I'm not signing up for that one. That's for sure.
Yeah, and we did ours 7 years ago, and I know like Pete, he is prone to inflammation. Like he has the genetic markers for inflammation. I don't have that on mine. My labs don't show that, but his does, and he gets the pain in his joints more easily, and he's Mr. Health nut and everything else, but genetically he is predisposed to inflammation, and that's just the cards that he was dealt. So, and for me, I tested for a gluten intolerance. He did not, so.
But his lifestyle too. I mean, he exercises on a daily basis. He gets plenty of sleep. He's very, very regimented.
He drinks like 2 gallons of water a day. I mean,
yep. So he does all of the things that he should be doing for himself, as opposed to not getting enough sleep, not exercising, doing 2 gallons of Mountain Dew a day, whatever the situation is. So, but it's not bad luck. It's not bad genes. It's bad lifestyle choices. And once again, I'm not bagging on people who are not making great choices. I'm not perfect, but at the end of the day, like if you know that you've got these genetic issues, don't push the envelope. And you don't have to be running out and getting put on these drugs like methotrexate, which actually was a chemo drug and didn't work for cancer. So they started giving it to people with arthritis, and people are taking it every single day, not knowing what the side effects are of taking this drug long term.
oh my God.
So, I mean, if you can stop eating sugar and increase your vitamin D, and not saying that that's going to work for everybody, but like genetically, if we were to look at certain things for certain people,
Yeah.
if you're able to do that, like that would be a way better choice than now you're being treated for cancer down the road because you took a cancer drug for arthritis. So,
I didn't even know that. Jeez. I'm like thinking, should I ask everyone in my family? Is anyone taking this? To my knowledge, nobody in my family is taking it, but my extended family, I mean, who knows? So, well, thank you, Dr. Jen. This was a very educational, informative episode as always. Thank you for your knowledge and your wisdom and insight. Thanks everybody for listening. If you haven't joined our school community before, I'll put the link in the show notes. You can also follow us on Facebook, Instagram, or subscribe to our YouTube channel. Until next time, everybody. Bye-bye.
That wraps up another episode of Speaking Holistically. Thank you for listening. We hope today's conversation gave you new insights and inspiration to take charge of your health. If you enjoyed this episode and want to hear more, be sure and join the Speaking Holistically school community by clicking the link in the show notes. There, you'll get access to daily podcast episodes, weekly live Q&As, educational content, and so much more. You can also connect with us on our Facebook page, follow us on Instagram, and subscribe to our YouTube channel. Until next time, be well, stay curious, and keep speaking holistically.